Hi everyone, I'm Lori with Behavior Education at Spirit Keeper Equine Sanctuary, and I am joined this evening by Sarek, one of our Royals at the ranch. We're introducing you to this episode of Training Tuesday for Tuesday, February 1st, 2022. I can't believe it is already February 1st, 2022. This year's off to a fairly good start for the most part. We're busy here at the ranch doing snake training and dog training and horse training and taking care of our animals. In tonight's episode, you are going to get to see a little bit of snake training, but you're also going to get to be trained yourself on how to go ahead and inject feeders with medication that your snakes need to ingest orally. What we're going to do is thaw out a couple of mice for our patient. And once these are thawed out, then I'll show you how we're going to inject one of them with his medication, and we'll go from there. So I've already got the medications that the vet prescribed out. This is an antibiotic. This is a different antibiotic because I have two different snakes right now on oral antibiotics. And then there's a dewormer that one of them's getting, and I've already pulled up the dewormer into this syringe. I'm going to pull up his antibiotic now. And if your vet does not dispense the medication with one of these nifty little things in it to help you draw out and dispense oral medication, you can order those on Amazon or at any medical supply place. And it's really convenient if you have to give oral meds. I really like it a lot. So this antibiotic is for one of our Darwin carpet pythons. Her name is Slipstream, and she has a respiratory infection that we cultured, and the type of bacteria causing the infection needs trimethoprim sulfa, and that has to be given orally every day for 30 days, and so that's what this prescription is for. So what I'm going to do is I'm going to take out the rodent that I've thawed for Slipstream. I'm just going to inject it. You can inject it right into the stomach, or you can inject it under the skin. And there it is. And then I'm going to feed her that rodent. I realize that I said she has to have this every day for 30 days. So I do not always administer the medication this way. I normally have to pick her up and open her mouth and administer it orally, in which case we do not have the needle on the syringe. We pull up the oral medication, and then I open her mouth and make sure that it goes down her esophagus.
I'm ready.
This is Starburst Dewormer, and I've already pulled it up in the syringe. And dewormer typically only has to be given one time, or maybe one time and then repeated in 2 to 3 weeks. And that makes it really convenient because you can put it in the snake's food. And I'm just injecting it right into the rodent the same way that I did Slipstream's antibiotics. And both of those I put into the stomach, but I'm going to show you how you do it under the skin, because in addition to the dewormer, Starburst also needs an antibiotic. They both have respiratory infections. They both are caused by different bacteria that need 2 different types of medications. So when we put this under the skin, you're just going to pull the skin up a little bit and make sure the needle goes under the skin, and you're going to put the medication in. With dewormer, you can pretty much always put it in the food if it's okay to feed the snake, and the vet said that this is a great way to do it. Unfortunately, when the oral medication has to be given every day, you can't feed your snake every day. That wouldn't be healthy for them. So you can only do it on the nights when they're going to get fed. In case you're wondering what all these medications are, this antibiotic that is for Starburst is trimethoprim sulfa, and this antibiotic that is for Slipstream is marbofloxacin. And marbofloxacin is a liquid medication that also had to be compounded, so I had to get that from a pharmacy that does that. Starburst dewormer is fenbendazole, And yes, it is the same fenbendazole that you would give a dog or a horse or other animals, but obviously not in the same concentration and not in the same dosage. And that's why it's really important that you do fecal checks to know what, if any, internal parasites the snake is infected with and what exactly you need to use to combat those. And you need to do oral swabs to make sure that you know specifically what type of bacteria is causing any upper respiratory infections that are due to bacteria and what antibiotics work against those specific bacteria. Because each of these two different bacteria that are infecting slipstream and starburst are resistant to ceftazidime, which is an injectable antibiotic. So we can't use it because it won't do any good. So we're having to give them these oral dosages, and I give it to them in their food on meal nights, and the other nights I just have to take them out and open their mouth and give it to them through an oral syringe. And I also want to mention that both of the snakes have been tested for nidovirus while symptomatic, and they were negative for that. So we definitely know that the upper respiratory infections are being caused by bacteria, and we're getting them treated for that. All right, now we're gonna feed him, and I don't do any training when I'm just medicating him, but because he's getting his medication in his food this time, I'm going to target him. And as you can see, he's responding to the target. So that means that he doesn't have any negative associations necessarily with me or with his target training. He just has negative associations with me when he's getting medicated. When I'm putting the medication in the food, I go ahead and do a normal target training session because there's nothing negative associated with that. But when I'm medicating him and he's not eating, I don't do any training at the same time because obviously that's not the best experience for them. And we don't want to poison the training cues. She's on top of her humid hide. Everybody, thank you so much for watching. I wanted to let you know that there was some other training that went on tonight, and it's human training. Sarek has me trained to let him out when he comes to the door. And Ronan has me trained to do that too. Ronan's right here, and Ronan definitely has me trained that when he comes to the door, I should open it. So these are my two snakes that probably come out the most often, along with TC, Tau Ceti, our super dwarf reticulated python. He's going through an ecdysis cycle. And so I get a little bit of a reprieve, and I only have to keep track of 2 snakes that are out tonight instead of 3. Everybody, I hope you learned something in this episode, and until next time, please remember to always be kind and love your animals.